Okay, so for this case, the first thing I did was map out our nerve on both sides in the mandible, and then I basically just added in some implants where I thought the implant should go in relation to adjacent two structures. Keep in mind bone. This would be where I thought would be site number 5. This is where I thought implant in site number. So this is 5, 6, 7, 8, 9, 10, and then 19, 20, 21, 22, 27, 28, 29, 30. And then what I did was I put teeth in these areas to make sure that I was happy with the prosthetically it could be driven. And then after I did this, I'm looking something like this. I started to import these surfaces. So I basically what I did was I had the CT scan, and I confirmed the orientation of the teeth, and then I added in the upper model scan, basically what he has currently. This, and I also added in the I stitched in the lower model scan. Now, this is not his bite, but it is very close to his bite. He does fully occlude on these two teeth. So back again with our teeth in the equation on the upper and the lower. This is essentially where he is at, and I'm trying to get a good idea of where he where the provisional is, or the final implants may be. And this was just kind of like my wax up. Fortunately for me, that we have a wax up, so I scanned both of those in on the upper and the lower, and you can see for the most part I'm pretty close on my planned implant placement for the lateral site and the premolar. The lateral needs to be adjusted because it's coming out too far on the cingulum. It's going to be a ridge lap crown. But on these posterior areas, let me get rid of the upper. On these posterior areas, if I add the teeth back in, you can see that it's coming out pretty much through the central fossas. We'll turn the guide tube poles on so you can see that. It's pretty much the central fossas except for this one. These two look good. And then, so what I'm going to do is just make adjustments because you can see this lateral is coming too far out. Let me turn these off and turn the wax up surface. This is really what I want to judge it based on, upper wax up. So I'll turn the lower off. Yeah, it's just a little bit too far lingual. So we'll go into make adjustments on this one lateral, and then we'll be able to make our guide. See, now that's actually pretty good. Let's see, implant. And then that's it right here. I could just rotate it like that. That looks good. We'll look at it again. That looks a lot better. All right. So this will work out pretty fine. Now, I'm not going to make my guide on this model. I'm actually going to make my guide on these models one at a time. So to do that, I'll click off the lower model and click off the lower implants. Just the upper implants. Let's see. All right. I'll get rid of the nerve. I'll get rid of the guide tubes up here. And then all we got to do now is start making our guide tube, or our surgical guide. So I'll go into guide panel, make sure I'm on the upper, not wax up, but the upper model scan. I'll click on maxilla, draw curve, click on shift, and hold down the left click button. Edit curve. And I want to make sure that on the implants areas, I'm on pilot drill kit at a 3.1 millimeter guide tube diameter. So now what we'll do is click on create surgical guide, back in the guide panel. And here's our guide. It looks good. I'm happy with that. So what I'll do now is go back into surfaces, turn this guide off, turn this upper model scan on, turn the lower model scan on, turn the implants and invert them essentially. So I'll turn them all on and then turn the lowers or the uppers off with the upper guide tubes. Okay. So we're going to place implants in these areas. I want to double check this one right here. It does seem a little off in this image. So we'll go back in cross section. I could manipulate this a little bit. So it's going to look a lot better than what was originally planned, especially based on the tooth in this area. Lower left, second premolar. That looks better. And I could even bring it a little bit more mesial. Okay. Mucho better. So I'm happy with that. Okay. So we'll turn the teeth back off. And we will now go into creating our guide. Going back to look at this, I'm really not happy where this one's landing up. But if you'll go back into the bone in this area, this is the planned implant placement. You can obviously see I'm having some issues. Let me see if I can make some adjustments here. Go back into implant, click off of that. I'm going to have to rotate this a little bit more. Restoratively, that's going to be a little bit better. And I'll scoot it back a little bit more. That looks good. Better, not great. I'm not happy with the bone volume in this area, so I'll probably add some PRF and some bone graft for sure on the buckle. But this looks a little bit better in the bony housing. I could even angle that a little bit more. It just seems really angled to me in this cross section, but it's looking better on the model. So what we'll do now is we'll just create our surgical guide on this. It looks better. So lock all these. Let me look back at the teeth on this right side. Let's see. Mandibular, first molar, the implant. And what you could do is go back into teeth, click on this, and lower the transparency. Let's see, molar. I don't want to play. It's not playing with me today. So typically what you do is highlight this and change the visibility settings of whatever tooth you want to manipulate so you can see through it. So what I'm looking at right now is it basically in a better restorative plane than where it was originally. So I'll turn the teeth off back again. And then I'll create our surgical guide on this. Again, not on our wax up, but on this. So model manipulation. And then we'll go into guide panel. Make sure we look at lower model scan. Mandible, draw a curve, hold down shift, go all the way back here. So this is going to be pretty much on soft tissue in the distal areas. So all the retention is going to be in the anterior. You just have to be careful of any type of movement. So I really like pilot guides for this. And we'll put metal guide sleeve tubes in there. Okay. Let's see. Create surgical guide. Here's our lower guide. So now all we have to do is go back to services, turn this off. So we have a upper surgical guide, and we also have a lower surgical guide that we have to export to be used for the day of the surgery. And that's it.